Welcome back to the Academy Table. I'm Renee De Silva, CEO of the Academy and your host, and I'm happy to have you back with us again. I'm excited to share this latest conversation with Judy Faulkner, who of course is the founder and CEO of Epic. I've had the pleasure of meeting and getting to know Judy a few times across the last couple of years, and she's an impressive entrepreneur whose willingness to think differently drives her success. And in this conversation, that sentiment comes through in both serious and lighthearted ways. Our time together covered a lot of ground, but I'd like to call your attention to 3 takeaways. First, I've always appreciated how Judy stayed true to her conviction, especially early on, keeping Epic as a privately owned company. And she shared several insights on how that continues to apply to her leadership style today. Next, listen for Judy's future orientation. Impressively, she zooms out 50 years when thinking about and guiding key decisions about Epic's future. This forward-looking perspective also led to some great predictions around the next decade in healthcare and really beyond. And finally, Judy likes to saying, you have to laugh to learn. And I found myself throughout our conversation laughing and learning as we went. I hope that you will do the same. With that, let's head to the table. Judy, it's so good to be with you again. Thank you for joining me at the table.
Well, thank you.
So we were last together in person in July, and one of the topics that we were chatting about is the future of healthcare. We're calling it Horizon 2030. If you were yourself to think about broad brush, where do you think healthcare is going in the future? Bold prediction, maybe with a 10-year lens. What comes to mind for you?
With a 10-year lens, what comes to mind to me is what's happened in the past, which is there are technology surprises. New capabilities exist in the technology that our software can run on, and then we utilize that to do really nifty new things. And in addition to that, there's going to be good stuff coming around with merging the genomics data with the EHR data, allowing us to look more deeply at what is happening to people and how do we predict what can happen. There's going to be the ability to take the results of research and bring it back to the practicing physician who is with the patient, so that instead of having only 10 to 20% evidence-based medicine, which is what there is now, so many decisions are not made on evidence, even though everyone wants to. We can get evidence from observational data and bring it back. So those are the things I think we're going to see that will make a big change. We call that, by the way, best care for my patient, taking that observational data, bringing it back, putting it in front of the physician who could see, here's how patients similar to the one that you have in front of you now, here's how those other patients have been treated, and here's what resulted. 18,000 were given drug A, 22,000 were given procedure B, etc. And the physician or clinician can review the results and make a decision. I think that's going to be very transformative, because with 118 million, I think it is now, patients in the database with their EHR data, there's a lot of information that can help clinicians make decisions. But to answer your question, I'm going to go a little bit further than 2030. And Einstein said, I don't know what weapons World War III will be fought with, but World War IV will be fought with sticks and stones. That's on one side. On the other side, you have the book Homo Deus, which is saying that death occurred in the past from war, famine, and pestilence. And now we don't have many wars, we don't have many famines, and we don't have much pestilence that is as worldwide and as dramatic as we have had in the past, even though there's some of everything. And they're predicting, or the author is predicting, that in the end, medicine's goal is to keep you alive, and people will basically be able to be alive virtually forever. So that is long-term prediction that is there. I think that's quite fascinating to think about.
That is fascinating. And in some ways, if you just go back to maybe your 10-year view on this notion of best care for my patient, how do I think through really hardwiring evidence-based care? The Epic platform is uniquely suited to do that. So I was just struck in just preparing for our conversation today that 2/3 of the US population are on Epic, about 225 million patients. So just all of that insight that your organization has to harness to collect. I know that you are doing some interesting research inquiry through, I think it's called Cosmos. Talk to us about how you think about Epic's health research network and what role you play in really activating this best care for my patient anchored in this evidence-based approach.
Cosmos came about because we saw that we had all that data and we want to take the information and utilize it to help make the right decisions and to help do research, given that that wealth of data is there. So Cosmos collects the data from our health system customers that the only users hands-on of the data can be the health systems who have contributed to that data. So there's that trust that it is their own data and they're very careful with it, same as we are. And we wanted to be able to look through it to be able to make all sorts of decisions. Some of the first things we looked at came about because someone would make a comment, like with COVID, there was a comment that I can't get hold of ventilators because they're not available. So we're putting our COVID patients on their sides or on their stomachs, and we think they're actually surviving better. Well, that took us right away to let's look up, is that true or not true? And we were able to find the survival rates on ventilators, which was quite scary, actually. Then another study was done on if you're taking anything prophylactically, will it help prevent COVID? And we found that indeed, we couldn't find anything that would. And hydroxychloroquine, which was in question at the time, was one of the ones that we didn't find that it had any prophylactic effect. So those are some of the reasons we were doing EHRN and Cosmos. One of the things I think is really interesting is how we do EHRN, because given COVID, we needed to get things out fast, and being able to come up with some answers and then send them to a journal and wait for months before it got published would not be helpful enough. And so we knew that we couldn't have wrong answers, but we didn't have time for peer review. What we did was a different kind of peer review. We have two teams, they're called Team A and Team B, and each has a clinician, a data scientist, a software developer, and other staff on it. The two teams get the same assignment, and then they're not allowed to talk to each other from then on until they're done. And when they're done, we look at the results, and if the results are the same, then we feel safe publishing it.
That's fascinating. And it sort of speaks to the power of crowdsourcing the insight from within the health system community, which is a big part of what we think about at the Academy. If we stay on that for a moment, when you think about the questions that get asked, are those all driven? How do the questions get formed? Those are all driven from your members and your own team, or just talk a little bit more how you bring that to life, and maybe just an example even outside of COVID of where you found something interesting in the data that you then might want to activate on.
The questions come internally. They come from our customers. A lot of them come from our customers who are asking us to look up this or look up that. They come from public health organizations, and they come from the government. Of course, public health is a subset of the government, but all those areas contact us and ask us to look into this or look into that. Sometimes we publish what we find, and sometimes we just give the people the answers that they asked the questions about.
I think that's powerful, especially nowadays when there's such an effort to just distill sometimes a fact from fiction, being able to get in there and really get to it. I was doing a little bit of browsing before our conversation, and we all talk about this notion of, this is totally unrelated to a science-based thing, but we will all talk about this 20 that people gained when they were in quarantine. And I think the Cosmos data set would say that that is in fact not true, that just as many people lost weight as gained weight. And so another example of dispelling myth through the data.
Well, the group it's true for is young adults. Kids gained more weight than adults did. Isn't that interesting?
That is interesting. It makes sense with the amount of video games that were consumed in my household, at least. I can see how that that would make
That's
sense.
pretty funny.
Yes. That's great. Okay. So one of the things that I'm struck by, Judy, is just your own personal story and your personal conviction. I think most people know this about you, but Epic continues to be a privately owned company. You co-founded it, still maintain direction and strategic influence over the organization. You've been pretty focused on not taking outside investment, which today sounds like a really smart decision. I'm sure you had pressure along the way back in, I think, the late 70s when Epic was launched. How did you just stay true to your own conviction on that?
Well, first of all, you had to believe in it. And I've often thought that I was lucky that I didn't get an MBA in business, because it would have taught me all sorts of things that if I had done them, I don't think Epic would be as healthy and good as it is right now. So things like, don't go out for venture capital because they're going to want to flip you. And I didn't want to put all the effort I was putting into growing Epic just to sell it. To some extent, I've thought of it as, in order to really grow Epic, I had to spend a lot of time working through all sorts of things, the software, the helping customers, the installs, the testing. And I didn't have as much time as I would have liked to be with my children. And so sometimes when I think of the potential sale of Epic, I think, how could I put a price on my children? So how could I put a price on Epic? It might not make sense,
Yeah,
but
it does make sense.
That's what occurred to me. Yes, there were pressures to sell Epic from some of the original shareholders, but that didn't happen. We didn't do that. And then, of course, to go public is the other big thing people typically do. But I've always wondered, why would you want a whole bunch of people owning your stock who the only thing they cared about was return on investment? And really, we care about, is it helping the patients? Is it helping the health systems? How are our staff doing? All those things too. So it made sense to stay private and to have our ownership be our staff.
So Judy, one of the things that I'm just struck by is how clear of a decision maker you are. Just you have a perspective. And so just talk to us a little bit around how you approach decision making.
Many decisions I make by jumping 25 to 50 years ahead, figuring out what will Epic want and at that time, and then come back and make the decision that later on they will have said that's a good decision. And an example of that is when we were first building the campus, I was asked, do you want parking to be underground or above ground? Now, above ground is about $800, $400 a spot for a car. Underground was like $14,000, $18,000 for a spot for the car. Tough decision, it seems like, because it's so expensive. But I jumped 50 years ahead, and I thought everybody's going to be very happy if it's underground, because this is Wisconsin, it's cold, you got to scrape your car, they'd have to walk distances, it would be unattractive, all those things. So I came back to today, and the answer was easy because of going forward. The hard part was it was expensive, but it was the right answer. So I said underground.
And staying on that for a moment, you seem to balance this cutting through the noise on decision making really well. So having your conviction, balancing that. But I also hear you talk a lot about your customers and your employees. And so how do you yourself think about getting input, balancing that input, and then ultimately moving forward with whatever you think is the right direction. This notion of getting input, but then also staying the course on the direction that you feel like is the right way to move.
I think one of the secrets to running a company well is making sure that there's a lot of ownership distributed throughout the company. So we have people developing software who own that, and they really care because they own it. And we have people doing the implementations who work with their customers, and it's on their shoulders and they own it. And so the making of decision is really distributed significantly across those people who have to live with those decisions directly. Now, I do make a lot of decisions, but when you consider we have about 11,000 people and we're in 15 countries, there's no way I can make a huge number of the decisions. I might make some big decisions such as, do we decide to build some more buildings? But other than that, most of those decisions that get made are made by the individuals for whom those decisions mean the most, and they have to live with them.
And over time, as you've led this company, maybe reflect a little bit around current state. Where do you find yourself spending most of your time these days?
Well, if you want to look at just recently, it was the users group meeting, getting prepared for it, giving a talk, feeling silly in a costume. But
what was your costume this year?
I was a woodland sprite, and the theme was legends and lore.
Huh.
So you feel silly in those clothes. I even had wings on. I've said no to anything that involves ears or tails.
That's
so
great.
You feel silly, but there's a saying that goes, you have to laugh to learn. And I like that saying. And can you imagine hours of just going over software? That would be so boring. So how do you do it in a way that people find it interesting, and you have to bring humor to it? So that's what we do.
I love that. I know that the Epic headquarters has sometimes been referred to as an adult Disney because you have spent a lot of time thinking about creating space for levity and joy day to day. And so I wonder, just given how important the campus feel for you has historically been, how has the return back to campus been for you and your colleagues?
Well, there's a couple things. First, the return back to campus has gone quite smoothly. Most of our staff were voluntarily immunized or vaccinated. And I think we were like 97% vaccinated when we said everybody does have to be vaccinated. And now we're almost 100%. So we're very close to that. One thing I will say in your comment about our staff, we have 83% of our expenses go to staff. About 10% go to the campus, and the remainder is just other miscellaneous things. Our campus helps us hire good people, and our campus helps us create an environment for productivity. There's a lot of things built in our campus, besides the fact that the buildings are themed, that people might not realize has such an impact. We have private offices. We're trying to have private offices for every person who wants one, which is usually around 80% of our staff want a private office. I think you get productivity increases when you can really concentrate with the door closed and think about what it is you have to do. So we have private offices which increase productivity, and the campus is fun. So I think it helps us hire better. If we can increase productivity through hiring better and through the increase that you get through private offices, and our staff will give you significant numbers of what percent they think those two together add up to. But if we can increase it by 20% total, that pays for every building, every blade of grass in the grounds, every brick. It covers it because of the difference of the 10% to the 83%.
Yeah, I think, and even just more on a emotional level, you see that that's what people miss, right? People miss coming together, locking eyes to eyes with their colleagues, and feeling that they're part of a shared mission. So it feels like Epic is probably one of the few companies that really have that esprit de corps tied to the campus environment. And so I think I've never been, but I would at some point like to visit because it sounds like a really special place to be.
You are most welcome to visit. That would be very nice to have you
I would
here.
love that. I would love that. Let me ask you two other, maybe on this topic of leadership. One is, I'm just struck by what you have been able to accomplish professionally. You also have 3 children. You've mentioned that maybe, and I feel this way too. I don't always day to day feel like I contribute to work as much as I do to home, or sometimes it's vice versa. But I wonder if just what you accomplished when you launched Epic, co-founded it in 1979, you fast forward to 2021, so few women in CEO roles today, certainly even fewer founders. Do you ever dwell on that, or is that just something that just really hasn't necessarily been in your consciousness?
I don't really think about it, and I think that actually helps, because if you don't think about it and you're just a human being doing the work, that's very freeing to think of it that way. I think what I do think about more is what we discussed earlier, which is staying private makes such a big difference.
Yeah, controlling your own destiny. And in some ways, that's where the power comes too, is you're able to, it sort of shifts the maybe norms or established power dynamics. So I think I just have deep respect for that perspective. I appreciate you sharing that. And I've also heard you say that you have no plans to retire, that you feel like that is just not on your radar. So how do you stay energized, and any new thinking on that? Or you still feel like you're going to wake up every day and continue to do the great work?
It's not even wake up every day. It's at night. It's what you think about as you go to sleep. It's what you wake up in the middle of the night thinking about. It's what you wake up in the morning thinking about. There's just so much to do, and there's so many different directions we're going at once. The electronic health record is really the engine that is powering so many different things that we're doing that go beyond the electronic health record. And that keeps us very busy, such as Cosmos and EHRN and another thing we're doing called Epic Share, and working with specialty diagnostics and working with the payers and so many other areas that we're doing, that there's tons going on. And you would need a few lives, I think, in parallel to do everything.
I'm sure. And when you're not at work, where would I find you if you were let your hair down, you were relaxed, you weren't thinking about all that remains to be done professionally? What do you do to unwind?
Well, maybe 3 things. 1, I like to read. So there's a lot of reading that goes on. 2, I like the garden, especially a vegetable garden, because I like to cook. And so making interesting meals with interesting spices, or listening to a show about how to make things. I like that.
That's perfect. That's a perfect lead into my final question, which is we talk here a lot about the power of a table. When you have people around it that you enjoy talking to, you have created a good meal for them to share. I probably ordered in a good meal for them to share. If you could pick any 2 people to invite to that table, could be fictional, could be someone alive, they could have passed on, who would you invite to your table and why?
I would go to the future. I would invite someone 200 years from now to find out what was going on. And then I would invite someone who's way at the end of the human lifespan, before there were no more humans in our world. And that's who I would invite.
Fascinating. Well, I so appreciate getting to know you a bit more today. Thank you so much for joining me. And I will have to make a trip to campus at some point in the not so distant future.
Thank you very much. It's been nice speaking with you.
Thanks again for joining me at The Table. The Table is a podcast produced by the Health Management Academy. Make sure you catch future episodes by visiting our website, theacademytable.com, or by subscribing on the podcast platform of your choice. And if you have suggestions for topics or guests, I'd love to hear from you. Please drop me a note at renee@hmacademy.com. I look forward to talking with you soon.